Hello, this is Dr. Grande. Today's question is, what is narrative therapy? So narrative therapy is a therapeutic modality, and it can be used with families or with individuals. And it's based on a few key concepts surrounding the idea of a person's life and their story. And there are several stories in a person's life, and narrative therapy is looking at how to change a problem-saturated story into a more productive story. So part of the idea behind narrative therapy is that identity is formed by the narrative of a client's life. And there's actually several narratives that are at work, and this interpretation of the narrative can influence thinking, feeling, and behavior, and can result in mental health symptoms. Many narratives are useful or healthy. We would consider them relatively normal. Other narratives are focused on difficulties. These are referred to as problem-saturated dominant stories. So symptoms come about when there's an unhealthy or negative narrative, or if there's a misunderstanding of the narrative, or a misrepresentation of the narrative. And this can interfere, this interpretation can interfere with an individual's ability to make changes. So narrative therapy has a lot of qualities about it that make it quite a bit different than a lot of other therapeutic modalities. To start off with, in narrative therapy, there's no diagnosis. So right away, you can see that narrative therapy breaks from mainstream modalities fairly significantly. There's no use of the Diagnostic and Statistical Manual in narrative therapy, and no diagnosis is given initially or at any point during the therapeutic process. The problem is explored, mental health symptoms are explored, but they're never named with a diagnosis. So what a narrative therapist does is seek to understand the narrative, the positives, and the strengths of the client. They look for an alternative way to understand the narrative or to describe the narrative. The role of the therapist in narrative therapy is that of an investigative reporter, a non-directive collaborator. A therapist in this modality is extremely curious about the narrative, particularly the client's perception of the narrative, the client's point of view. And they're particularly curious about the nature of the problem. They're not particularly interested in the cause of the problem. Etiology is not really a part of narrative therapy, just like diagnosing isn't a part of it. But they are open to the client's description of the problem, what could be the cause. They're open to the client's perception of the cause. As I mentioned in narrative therapy, the narrative therapist attempts to externalize the problem. Now, this is a fairly common technique in a number of modalities. I think what makes it different for narrative therapy is the level of vigor brought to this concept. This is beyond just mere identification with the problem. So, for example, if someone's treated by a cognitive behavioral therapist, I wouldn't be surprised if that therapist, if a person came in and said they were depressed, that therapist would say, you're a person with depression. A cognitive behavioral therapist would be reluctant to identify the person as depressed. They would look at depression as something external, a person with depression. With narrative therapy, they do that, but they take it further. So the externalized problem really takes on sometimes human characteristics. So as I mentioned, it's not merely just not identifying with the problem. It's looking at the problem as having a mind of its own, as trying to interfere with one's day, as being subtle or sneaky, being crafty, tricking the client. We see this particularly when using narrative therapy with adolescents or children. A behavioral problem will be externalized and given this identity as being subtle and trying to trick the child or adolescent into doing something that would be unacceptable. There's a phrase that's popular in narrative therapy that the person is not the problem is the problem. And this phrase is really seen throughout the theory, the whole theory of narrative therapy, and particularly with this externalizing the problem technique or position. Language is important to narrative therapists, self-talk, of course self-talk from cognitive behavioral therapy, and questions. As I mentioned, a narrative therapist is curious. They ask questions about influence and the future. So how does the problem influence the client? How does the client influence the problem? So kind of a systems theory at work here. And what's the future hold? There's a positive orientation and there's a willingness to explore the future. Narrative therapy, of course, is also willing to explore the past and look at the present as well. A narrative therapist seeks to emphasize an alternative story to help a client to build an alternative story. They believe that positive stories lead to preferred outcomes. There's a term in narrative therapy, unique outcomes, and these are exceptions to the dominant story, much like we would see in solution-focused therapy. Narrative therapists also refer to these exceptions as sparkling moments. So again, emphasizing that curiosity and good listening skills and really paying attention. There's other features we see with narrative therapy, letters. These can be letters written on paper or emails or some other way of communicating, but it'd be written communication. And these are provided after the session. They could include information about the alternative story, unique outcomes, and of course they're generally supportive. Also, narrative therapy, as I mentioned, can be used for families or with individuals, but even when it's used with individuals, there's an emphasis on including other family members. So again, here we see a little bit of systems theory at work in narrative therapy. So a narrative therapist tries to deconstruct a problem-saturated narrative, separate the story from the client, rewrite the narrative, accurately understand this new narrative, and ensure that this new narrative facilitates change, the kind of change the client is looking for, one of the goals of therapy. Narrative therapists seek to reconstruct identity, and they have an awareness of larger societal issues, socio-cultural and political effects that are acting on the client. So when we look at pure narrative therapy, it's a postmodern and constructivist approach. There's an emphasis on social justice. As I mentioned before, etiology is not a concern in narrative therapy, causation. So how about the limitations of narrative therapy? Well, narrative therapy has a lot of positives. It also has some limitations. One of the major limitations is that there's a lack of research demonstrating that narrative therapy is effective. There are a number of reasons for the lack of research. One of the arguments that I've heard that explains why there's a lack of research has to do with the scientific method and the view that narrative therapists have. The scientific method is about seeking truth, but in narrative therapy, knowledge is subjectively constructed, and there is no universal truth. So some narrative therapists have made the argument that narrative therapy should be studied qualitatively, for example with the phenomenological approach, and not quantitatively. And that's what we usually think of with the scientific method. Now this argument can certainly be appreciated. Certainly narrative therapy has a philosophy that seems much more qualitative than quantitative. But really when we look at therapeutic modalities and we try to measure effectiveness, we do so usually by seeing if a client's goals were achieved and seeing if certain symptoms are reduced, like reduced depression, reduced anxiety. So narrative therapy certainly could be studied with the scientific method. Again, I appreciate the philosophy and how the philosophy is a key part of narrative therapy. But to say that narrative therapy can't be studied because it has a particular philosophy doesn't really ring true to me. The scientific method has been used to evaluate many, many modalities over the years, and narrative therapy is not an exception to that. It can be studied with the scientific method, in my opinion. Another criticism I hear of narrative therapy is that it's relativistic, and that if pure narrative therapy is applied, a narrative therapist would be predisposed to have a client isolate themselves from social support. Now, I can appreciate these criticisms, and I certainly see the relativistic criticism. Narrative therapy does appear relativistic. In terms of isolating clients from social support, probably what's being referred to there is isolating clients from the dominant culture. So again, this goes back to a philosophy in narrative therapy, more so than a technique. A narrative therapist who follows the rules of narrative therapy strictly, I suppose, could be tempted to influence a client to break away from the dominant culture, the dominant story, which may or may not be a good thing for the client. However, this is a technique based on the ideology of narrative therapy that can be easily sidestepped. A narrative therapist can adopt many of the principles and techniques of narrative therapy and not take it to what some would consider an extreme, which is having the client break away from the dominant culture or dominant story. Certainly moving away from the dominant story to an alternative story is part of the therapy, but that doesn't mean that the client has to reject society or reject a significant part of society. That's probably taking narrative therapy really to an extreme, and I would be surprised if a large number of narrative therapists included this as part of their practice. Although, again, with the lack of research, it's hard to be certain on this issue. So narrative therapy overall is an interesting therapy. It offers a unique perspective. It values the perspective of the client, and it's creative. You can use a lot of features in storytelling when you bring storytelling and the narrative into therapeutic work. So I like a lot of the elements of narrative therapy. I wish we had more research on it. That would be helpful. And there are some concerns about how the philosophy could be extended in a way that would not be helpful for a client. Narrative therapy is a modality that I see as easily integrated into other modalities. So if someone didn't want to practice as a narrative therapist exclusively, I believe they could take a lot of the techniques of narrative therapy and bring them into whatever the main modality is they use. For example, CBT or existential therapy. Narrative therapy, I think, goes along well with a lot of other modalities. I hope you found this description of narrative therapy to be interesting. Thanks for watching.